Recognizing the member for Kelowna Centre.
Thank you, Honourable Speaker. When my colleague asked me to speak to her private member's bill, I was in the middle of working with Lyndsay Richolt. You will recall that she's a 42-year-old mother in my riding in Kelowna Centre. Lyndsay is an incredible human with a beautiful family and a tenacious spirit. Although patient and willing to wait her turn, Lyndsay was running out of time in her wait on BC's transplant list. Despite being her own best advocate, Lyndsay was getting almost nowhere until her local MLA went public. As someone who's always believed that we need to advocate for ourselves in the medical system, and who's been a patient advocate, I do believe that the need for advocacy has reached unacceptable levels. In fact, there are too many examples of impossible advocacy. If you can advocate until you're blue in the face, but there's no available services for your needs, then your advocacy is in fact impossible. At a time when, 4,620 British Columbians are dying in 1 year on a wait list, we have to ask ourselves, do we even value the sanctity of life anymore? No one in a civilized, compassionate society should die while waiting for surgery or diagnostics, but 4,620 British Columbians did. That's double the amount of overdose deaths in BC in 1 year. We are outraged over the amount of overdose deaths, and we see the evidence of this tragedy in all of our respective downtowns. But the truth is that we have a silent epidemic that is much deadlier, and no one is talking about it. We owe it to British Columbians to bring these facts to light and to have the conversation. The purpose of Bill 219 is simple and practical. It outlays exactly what a patient can expect and would need to know. First, patients will be told exactly how long they have to wait. No more wondering if it will be 6 days, 6 weeks, or 6 months. The patient will be told exactly if their wait time is unsafe or unreasonable for accessing their care. And third, this bill will achieve transparency. By sharing real wait times versus the recommended wait times, a new plan can be developed in all the cases where wait times exceed recommendations. This bill will inform the patient they can make a choice to travel outside their health authority or province to access the necessary care rather than just waiting. This bill restores transparency, respect, compassion, and accountability to a system that desperately needs that. So this bill shares medically recommended timeframes. It sets clear evidence-based timelines for diagnostics and treatment, and it gives patients something they've been missing: no more waiting in the dark. It requires notification when timely care is not possible, and patients must be told when their wait times become unsafe. But here's the beautiful part. They must be given real choices, including care outside their health authority, care outside the province, and alternative pathways or providers. I believe it's beautiful because it restores informed choice, puts the patient first and in the driver's seat. It restores the patient to a place of helping to choose the path forward for themselves. It restores dignity. Contrast that with my friend Lyndsay, left in the dark on wait times, calls not being returned, and then when she called, she was treated adversarially. There is no dignity in that. This bill ensures transparent reporting of deaths on wait lists. Health authorities must report when a patient dies waiting for a specialist or a diagnostic or for a surgery. The minister must publish an annual public report. These numbers can no longer be buried or minimized. So what does this mean for patients and families? Patients gain the right to know how long will they wait when delays occur, and what are their options? No more being left in the dark. This restores dignity for families who currently feel invisible. Communication becomes a right, not a privilege. And I believe this is a step in the right direction, a way to restore confidence and build back trust. Isn't that what everyone wants? No one wants to be kicked when they're down. And that is what it feels like for far too many British Columbians in the healthcare system these days. For healthcare workers, it supports the overworked professionals by making communication a system responsibility, not an added chore for them. Doctors and nurses want patients to be informed. This bill helps the system catch up to their professionalism. It provides data that helps target resources and reduce burnout. Transparency means clear publication of benchmark wait times for diagnostics and treatment. Accountability means tracking where delays are happening, reporting deaths, and most importantly, acting on the data. This bill forces the system to confront bottlenecks instead of hiding them. I think we all know what it's like to get behind on something, to be embarrassed by it to the point of hiding it. Whether it's a late bill or a late homework assignment, or that dinner that you promised a friend, knowing that you've failed in a responsibility or a promise is a highly uncomfortable situation. I know. I had a particular situation that taught me a valuable life lesson. When I was a young mom with young kids, I was behind in a bill and I was avoiding the other mom that I knew I owed it to. Finally, she confronted me and developed a plan with me to make it work. There was no judgment in her confrontation, just collaboration. There was so much freedom in that moment. A plan to deal with the backlog brought freedom to both the one who was owed and the one who owed the money. That's powerful. This bill seeks to bring freedom, power, and connection back to both parties, the patient who needs the care and the system that owes the care. And that includes the frontline workers who want to provide the care and want to do it well. So why this matters? Wait times are worsening across nearly every category. Staffing shortages continue to grow. Doctors, nurses, and more than 70 specialized professionals are stretched to exhaustion. When the system is strained, honesty becomes essential. And sometimes that's counterintuitive. Honesty is the only way forward. I recently wrote an article entitled "When Waiting Becomes a Death Sentence." In it, I talked about how as Canadians we have a Stockholm-type syndrome of love affair with our system. It's ingrained in us as Canadians that we have great health care and that it's free, and that the only way to talk about it, the only acceptable way, is with gratitude. But on the contrary, the truth is that we pay nearly $19,000 in taxes for each year for a family of 4. We also wait for services. We wait in the ER, we wait in the referral queue, we wait for diagnostics, and many of us will die waiting this year. We must begin a much more honest conversation about healthcare in BC that includes all of the uncomfortable facts. British Columbians deserve clear information, clear options, and clear responsibility. This bill ensures patients are informed, supported, and respected because timely information is part of informed care. Every life has inherent worth. This bill recognizes that patients are not numbers. They are humans deserving of honesty and dignity. All humans deserve care in a timely manner. All British Columbians deserve to be given other options if that care cannot occur in a timely and local fashion. Today, I invite all members to support a bill that strengthens transparency, builds trust, and honors the people that we serve. Bill M-219 does not cost compassion, it restores it. It ensures that British Columbians are never again left waiting without answers, without options, and without respect. It's time to choose accountability, dignity, and the sanctity of life. Thank you, Honourable Speaker.